Treatment of breast cancer. We should consider some points in treatment of breast cancer. Treatment of breast cancer is a multidisciplinary assessment. Multiple disciplinary assessment needs a multidisciplinary team involving surgical, radiotherapy, medical, and oncology opinions to plan the best treatment for each case, and decision making should include the opinion of the patient and the opinion of her family. We should think about breast cancer as formed of two components. The first component is loco-regional disease. Loco is the local tumor in the breast. Regional is the regional lymph nodes in the axilla. What is your weapon against our enemy? Our enemy is malignancy, malignant cells. My weapon against the malignant cells loco-regionally is mainly surgical removal of the malignancy surgically and post-operative radiotherapy to destroy any remaining malignant cells after surgery. This is the first component, which is loco-regionally, and our weapon in this fight is surgery and radiotherapy. For the Arabic student, بنفكر في سرطان البريست يا جماعة as primary tumor locally and the lymph nodes in the axilla regionally. This is the loco-regional disease. وسلاحنا ضد العدو بتاعنا في هذه المعركة إن أنا أخش بإيديا أشيل التيومر ده هون surgically، بس يمكن يتبقى بعض المالجنانت سيلز في المنطقة. فلو اتبقى بعض المالجنانت سيلز في المنطقة علينا بقى ببوست اوبراتيف راديو ثيرابي عشان ندمر ما تبقى من المالجنانت سيلز. The other component of our disease is systemic disease. What is a systemic disease? We all know that once axillary lymph nodes becomes histologically positive, we should think about that malignant cells also can reach the blood flow and produce occult distal micrometastases. And what is your weapon against these occult distal micrometastases, which are distributed all over the body? Sure, we need some sort of drugs passing in the bloodstream to reach every cell in the body to destroy every malignant cells in any organ in the body. What are these drugs? These drugs are including hormonal therapy, chemotherapy, and target therapy. There is a main point should be considered in your mind that treatment of breast cancer depends mainly upon staging and high risk factors. Recently, patients with breast cancer are classified into 3 groups in the treatment. First is early cases of breast cancer. Second is locally advanced breast cancer. And finally, metastatic advanced breast cancer. First of all is early breast cancer. What is the treatment of early breast cancer? First of all, what is the definition of early breast cancer? Early breast cancer in UICC staging is stage 1 and 2A. That is to say, staging equal or less to T2 N1 M0. What is this meaning? To remember the staging, stage 1 is tumor than 2 cm. Stage 2 is tumor from 2 to 5 cm. Therefore, if stage 1 or stage 2 means tumor less than 5 cm, this can be considered as early breast cancer, provided the N1. N1 means mobile axillary lymph nodes. And sure, early breast cancer is M0. M means metastases. Distal metastases sure is 0. What is the method of treatment in early breast cancer? First of all, and the main line of treatment is surgical treatment in these cases. Surgical treatment in these cases, there are two options. Breast conservative therapy or modified radical mastectomy. Let us first to say the most popular nowadays, and we tend for this line today, which is breast conservative surgery. Breast conservative surgery to remove the tumor and treat carcinoma with preservation of a main part of the breast is our aim for all surgeons nowadays. Why? Because this minimizes the psychic trauma of the patient. What is the indication of breast conservative surgery? First of all, it is the most popular if can be done. Tumor should be small. Always remember this picture. Small tumor, less than 4 centimeters. What is the number of the tumors? Single tumor, solitary. The tumor is central or peripheral? The tumor is peripheral. In large or small breast? In large breast. And all these factors solitary. Is small less than 4 centimeter. In peripheral area of the breast, in large breast, the patient should be low risk patient. Therefore, there is no liability for recurrent or appearance of another malignancy in the same or the other breast. Why the breast should be large and the tumor should be small than smaller less than 4 centimeter, and the tumor is peripheral? The main point in the treatment, first of all, is lumpectomy. We should remove the primary tumor with 1 cm safety margin around the tumor. If the tumor is 4 centimeters and we remove 1 centimeter all around, in peripheral area, in large breast, this means I can preserve large part of the breast. And this is our aim, preservation of large part of the breast. Tumor less than 4 centimeter, peripheral, and we can preserve a large part of the breast. This is our aim. If the tumor is in contrast, on the other hand, if large tumor in the central area, in a small breast, removal of large tumor with 1 cm safety margin. In the central part of the breast, we remove safety margin from all the quadrants, and the breast is already small. What is the part of the breast which you can preserve? There is no breast tissue to be preserved at the end. Therefore, breast conservative surgery is contraindicated if large tumor, more than 4 cm, central tumor, or a smaller tumor, or if the patient is high risk factor. Why? If you remove this tumor and preserve the remaining part of the breast, the remaining part of the breast is liable to develop another focus for carcinoma. If you diagnose this tumor early, it is good, but you may not discover the next tumor early and may be fatal for this patient. Therefore, contraindication to preserve any part of the breast, and this is indication for modified radical mastectomy, which are the reverse of indication. Contraindication of this technique is large tumor, central tumor, in high risk patient, in a small breast. What is the method of breast conservative therapy? It is called the therapy because it including 3 steps which should be done. The first step is lumpectomy, removal of the lump, removal of the tumor with 1 cm safety margin. This is lumpectomy, and should be associated with management of axillary lymph node, and the axillary lymph node dissection should be done if indicated, as we will see soon, plus radiotherapy, because you leave here breast tissue, which may include some malignant cells in the lymphatics or in the surrounding structure. Therefore, we leave part of the breast, and any malignant cells remaining in the breast are left for post-operative radiotherapy. Therefore, breast conservative therapy should include removal of the primary by lumpectomy. Second, management of axillary lymph node. Third, post-operative radiotherapy. Let us take the second step, which is management of axillary lymph nodes. What is the management of axillary lymph node in this patient? This. What is this? Early tumor, a small tumor with negative nodes, no palpable axillary lymph nodes. Before the operation. Before operation, we inject a blue dye, methylene blue, or radioactive silver colloid around the tumor or subalveolar, and during the operation, we detect. During the operation, we remove the primary tumor by lumpectomy, and another incision is made in the axilla to see the blue lymph nodes or to detect the lymph nodes by radioactive detector probe. These sentinel lymph nodes are the lymph nodes first receive lymph from the tumor, should be removed and pathologically examined. This is the management of the axillary lymph nodes according to the pathological examination of sentinel lymph nodes. If sentinel lymph nodes are negative, without any malignant cells. This usually mean in 90% the other axillary lymph nodes are negative, not affected by tumor, and no need for axillary dissection and removal of axillary lymph nodes, which decrease the incidence of arm edema. But if pathologically sentinel lymph nodes are found to be positive, this means that axillary lymph nodes usually affected by malignancy, and you should remove all axillary lymph nodes medial to the axillary vein. We remove level 1 and 2 axillary lymph nodes. Level 1 we all know, below pectoralis minor, and level 2 behind pectoralis minor. If these lymph nodes are grossly affected, we should remove also level 3 of axillary lymph nodes. This is the management of axillary lymph nodes. Management of axillary lymph nodes should include identification of sentinel lymph nodes and pathological examination. Negative sentinel lymph nodes, no resection is needed. Positive axillary lymph nodes, axillary dissection should be done for level 1 and 2, and if they are grossly affected, level 3 is also removed. During axillary dissection, at least 10 lymph nodes should be removed. This is a breast conservative surgery, and we'll continue the treatment in the next videos. Thank you for good listening and good luck.